Now, the Senate's also been talking about legislation called the Green New Deal. A dozen of our colleagues on the other side of the aisle have put this legislation in place. When you sponsor a piece of legislation, it usually means you're for that piece of legislation and think it needs to be debated, and it sure does. This is a huge piece of legislation. Called the green anything would mean that you would think that it would be mostly about climate change or environmental things, but actually most of it's about other things. I want to talk for a few minutes about what it says about health care. It's estimated that one part of the Green New Deal would cost $36 trillion over the next 10 years. That's about the same amount of money we'd spend for everything else over the next 10 years of the money we appropriate. It's such a big number, it's hard to imagine how you'd even describe it, but $36 billion would be 100 times what it would cost to rebuild the entire interstate highway system. So if you can imagine the entire interstate highway system and you wanted to build it all over again, build it again, go in and tear it up and build it again, do that 100 times over the next 100 years, or however many years it would take, that's $36 trillion. I might have even said earlier $36 billion, but it's $36 trillion, 100 times what it would cost to build the entire interstate highway system all over again. It's an absolutely enormous figure, but the government's accepting an absolutely enormous new obligation, and an obligation that just in terms of the health care part of this bill would again be more than all the money we would expect to spend over the next 7 years. That would take us through fiscal year 2025. Everything we'd spend on Social Security, everything we'd spend on Medicare, everything we'd spend on Medicaid, everything we'd spend on defense, on education, on homeland security, on interest on the debt, and everything else would be less money than we would spend in the first decade on Medicare for all. If you look at this legislation, it's pretty obvious that Medicare for all would, for a lot of reasons, be Medicare for none. One is that big a system probably wouldn't serve anybody very well, if at all. Two is that Medicare would be eliminated. It would just be part of a big healthcare system. If you're planning on benefiting from Medicare as we would know it today, that won't be there if this bill passed, because everybody would have something that would be theoretically like Medicare is now, but there wouldn't be Medicare, there wouldn't be Medicaid, there wouldn't be military TRICARE, there wouldn't be the Children's Health Insurance Program. None of the things we have now would exist. They'd all become part of this big system of Medicare for all. And in fact, it actually would eliminate private health insurance. You know, we are in this debate way beyond the debate of the days of when President Obama said over and over again, if you like your current health care insurance, you can keep your current health care insurance. Nobody even pretends with Medicare for all that would be the case. In fact, this legislation says specifically it shall be unlawful for a private health insurer to sell health insurance coverage that duplicates the benefits provided under this act. No choice but to look at Medicare for all. So when they say Medicare for all, Mr. President, they really mean Medicare for all. The other forms of health care coverage would be gone. One of our colleagues, who's also running for president, said, let's eliminate, this is a quote, let's eliminate all of that. That in the question was private health insurance. Let's eliminate all of that and move on. Well, Mr. President, what moving on would look like would be everybody again thrown into one system. There'd be not only a single payer, the federal government, there'd be a single system. You could call it Medicare for all or anything else you wanted to call it, but there would be one place to go. We're now spending about $6 trillion over the next 10 years on federal health care systems. This would go from $6 trillion to $36 trillion. And I could spend a lot of time talking about how could we afford that, what would the taxes look like. The point is, Mr. President, it's an outrageous proposal, particularly for the millions and millions of Americans that like the insurance they have, that get insurance at work. It's been a benefit in our country that workers first started getting right after World War II. It's been a benefit at work that workers have never paid taxes on. It's been a benefit at work that an awful lot of people have been well served by. We need to fill in the gaps. We need to create more options. We need to do lots of things. This isn't one of them. When people lose their health care options, when people begin to have to stand in line for health care like people do in Canada, they are quickly persuaded that whatever turn was made, it was made in the wrong direction. This would be a turn in the wrong direction. It would be something the government can't afford and individuals and families won't want. It would be something that people who have actually depended on Medicare being there when they qualified for Medicare, and people pay into all that their working life just like they do into Social Security, except there's no cap, so many people pay a lot more into that fund than they do the Social Security fund, but it would be gone. Medicare for all would be, Mr. President, Medicare for none. I think there's a reason that the sponsors of this bill aren't eager to talk about a lot of it and don't even want to vote on it. And if I'd sponsored it, I might not want to vote on it either. I yield the floor.